So today I'm talking with Jackie Rosen from What's the Difference podcast, and she's recently announced her pregnancy. So Jackie has taken this time to talk to disability maternity care about what it has been like for her so far. So thank you very much, Jackie, for
Thank you
talking
for
to us
having me.
today.
Thank you for having me. I have to remember my Zoom etiquette not to talk over people.
That's all right. It's always tricky, isn't it?
Yeah, but we're getting used to this. We've been doing this for how many months now? So this is definitely the new world, right?
It is, definitely. That's right. That's right. So Jackie, I'll just start with if you could tell us a little bit about your disability and what life is like for you, just to be able to put that into the context for the listeners, that would be great.
Okay, so I am currently 36 years old. I live in Toronto, Canada, and luckily that I was born where I was born because I was actually had access to world-class medical treatment from right after my birth. So I was diagnosed with tetralogy of Fallot with absent pulmonary valve, which is a heart condition, when I was 4 hours old. And my parents noticed immediately that I wasn't breathing like a normal baby, and that something was definitely wrong. And they pushed for me to be, like for the hospital to do investigation. And luckily, the children's hospital was directly across the street from where my mother gave birth, so I was rushed across the street. And I was told at that point, or my parents were told, obviously not me as I was a newborn, but my parents were told
Yeah.
that I had a 10% chance of surviving my first night.
Wow, that would have been frightening for your parents.
I can't even imagine now. I can't even imagine how scary and how terrifying that is when you have the highest moment of your life when your child is born, and then within hours you're told your child could die. So it didn't look good. I was touch and go basically for the first 4 years of my life. I spent more time in hospital than I did at home, especially the first year. The problem was, even though tetralogy of Fallot is four things wrong with the heart, but normally it's a little bit different with the pulmonary valve. In my case, I was missing the pulmonary valve, which is a rare version of tetralogy of Fallot.
Mm-hmm.
So because of that, the my lungs, basically the blood flow from my heart to my lungs was just flooding my lungs. And as a result, because there was no valve to control it, so as a result, I had lung damage and a hyperinflated lobe in one of my lungs. And because of that, the biggest danger for me for the first 4 years was pneumonia. And so I was, sorry, I guess your editor's gonna have to cut that one out.
All right.
I'm sorry.
No.
Okay, we can pick up from here. So I spent so many weeks in the hospital, constantly getting pneumonia, and I just couldn't. I had trouble fighting it off. I was constantly sick. My lungs were in such bad shape, and at that time they didn't operate right away because this was the mid 1980s. So I wasn't operated on until I was 4, and at that point they corrected most of my tetralogy and they put a valve in. And, it was a human valve, so it was taken from another heart.
Mm-hmm.
And then at 8, I had to have a valve replacement because that one wasn't working well. And that lasted until I was 24, which was amazing. And then they did a revolutionary new procedure on me when I was 24, where they inserted the valve through a catheterization rather than through open heart. I was one of the first 500 people in the world to have it.
Wow.
And yeah, it was pretty, and it was also scary too, because I was, it was very new at the time still. I was still in the first decade when they were doing it. And they even told me, you could die. And I'm like, well, that's the risk you have to take any surgery you go into, right? They told me at the time a maximum 1 to 5 years that I would get off of this valve. They said it was basically just to hold me over so that I could delay open heart a bit. It has been 11 years and my heart is still in really good shape. Nobody saw this coming. They're just like, how are you still, like, this is amazing. So I could still go without open heart for another, who knows how many years, fingers crossed. But in addition to the heart condition and the lungs, I've got all kinds of little things too, and some of it has come about from the heart condition, some of it has come about from the lungs, um, because I was my heart was working so hard when I was younger. I was completely underweight. I weighed all of 45 pounds when I was 11 years old, and I was not even 4 feet tall. So I was teeny tiny. And doctors even said, oh, you have an eating disorder, like you're just not eating enough. And it's just that I couldn't eat enough to sustain the energy that my body was using to keep my heart going. So I had to have a tube put in my stomach to be fed extra nutrition at night, liquid nutrition, like through one of those meal replacements. And I had that for 10 years, through my teenage years. So like from age 11 to 21.
That would have
And
been
that,
quite a challenge for you then as a teenager.
yeah, that was a challenge, but I was so underweight at the time. I was like, I don't care. I just need to gain weight. And so unfortunately, while that really helped me, I'm still quite short. I still only am like barely 5 feet tall, but it got me to a normal weight, which was great. And it kind of at least made me feel like I wasn't skinny anymore. I was able to fight off infections better. It gave me what I needed. Unfortunately, it left me, because I was sleeping when I would get fed, it left me with really, really bad gastrointestinal issues. So now I have horrendous reflux that I've had for years. It's just chronic. And I don't have a great stomach. I've got a very weak stomach because of that. So that was affected. But I also have a malformed chest wall. So my chest wall actually presses in on my esophagus. And in order for them to fix it right now, it would actually cause more harm than it would be if they just leave it, because they would have to break my ribs and re-sew everything together, which is not what they're going to do at this point, not when I'm 36. So that unfortunately also puts pressure on my esophagus, which makes it difficult, and it also makes it harder when I have respiratory infections. So that adds to the gastrointestinal distress and stuff like that. And then when I was 27, I had a really, really bad bladder infection that left permanent damage in my pelvic floor. And so I have been walking around for the past almost 9 years now, feeling like I have a UTI at 24/7, which is not fun. And it's just, at this point, it's a nerve disorder. It could be an autoimmune thing. They don't really know, because a lot of women actually have this, and it's called vulvodynia. A lot of women have it. They don't talk about it. Because it's still very taboo. Anything that has to do with your pelvic region when you're a woman, it's very taboo. So I've had this for almost 9 years. I've gotten used to it, sadly. There's treatments, or physical therapy. Antidepressants, funny enough, is one of the treatments, but it can work. Sometimes it doesn't work. And it's kind of just living with it at this point, which is not great, but I'm used to it at this point. And then I have an eye condition, which is the least of my problems, because it only causes blurred vision and pain. And it flares up at times. It's actually a genetic condition that I didn't realize. I was diagnosed at 24. And then I found out my dad and my mom both have it. So they didn't present any symptoms. I was the only one presenting symptoms. And it turns out so that's how they found out I had it.
Yeah, okay. That's quite unusual, isn't it? I guess.
Yeah, it's
Although,
a lot.
yeah, that they don't have any symptoms, and yet
I think that,
both have it, then there's more, I guess, chance for you to have it. Yeah.
Well, I think they actually, I think my dad started noticing something, so he went to the optometrist or the ophthalmologist, and then they diagnosed him with it. But luckily, out of all the things I have, that's the easiest one to deal with. So.
Yeah. Yeah, so you've really got quite a few challenges, and have had obviously a lot of challenges throughout your life. But, I guess coming into this pregnancy, you're bringing quite a few challenges that are going to create additional challenges for your pregnancy, aren't they?
Yeah. So at this point right now, I'm exactly 20 weeks. It has not been easy. And the other thing that I haven't mentioned is that I do deal with severe anxiety and OCD and phobias. So, which is kind of understandable after the medical history I've had.
Yeah, definitely. That's right.
So I have been in therapy on and off for 21 years. I My therapist right now says I'm doing really well, but one of my reservations, funny enough, my main reservation about going into pregnancy was not the heart condition. It was not the pelvic pain. It was the fact that I have what's called a metaphobia, which is a fear of vomiting.
Okay, yeah.
And so, I mean, I had enough reason to not be pregnant, and to go another route because I had all these different things wrong with me. And we actually had planned to go through surrogacy, and we had an egg donor because another thing is I'm not a great candidate for IVF, so I couldn't have necessarily used my own eggs because IVF clinics, at least in my specific location around Toronto in the province of Ontario, we don't, most IVF clinics don't have hospital facilities. So if something were to happen to my heart while I was being treated, they don't have a way to rush me into an ER or something like that. They would have to get me across town to another
Yeah.
hospital. And you'd think, you know, Toronto being the biggest city in Canada and one of the biggest cities in North America, that you would have that, but you don't. So that's not really an option for me. So it was basically surrogacy with an egg donor or an embryo donor or get pregnant. And my husband and I did originally go the surrogacy route, and it didn't work out. Unfortunately, it just, everything fell apart. And at that point, we were like, okay, it's been 5 years. We've been planning to have a kid. What if we try pregnancy? And it was really hard to come to that decision because we had been trying to protect my health. But we did the rounds with my doctors. They had all said before that, you know, I am able to get pregnant. It's just that I would be high risk, obviously. But it was really up to my comfort level. And I didn't feel comfortable with it until I no longer felt comfortable with someone else carrying my baby.
Before you'd explored that option.
Yeah.
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 So here we are.
Yeah. So congratulations.
Thank
Yeah.
you.
Very exciting. Yeah. So, so with your pregnancy so far, you talked about that you've got a fear of vomiting. So how was that for you at the beginning of pregnancy when nausea and vomiting are much more likely to occur in those first couple of months?
Well, first of all, my nausea has not stopped. I am still nauseous 24/7 for the
Yeah.
most part. I'm unfortunately having one of those pregnancies, but there's something about when you have a metaphobia, I think that your defenses against vomiting are so strong that you actually, your body doesn't know how to do it anymore. So I mean, I have been so sick, especially the first trimester was awful. The nausea was just terrible. And what makes it worse, of course, is my constant gastroesophageal
Mm.
gastroesophageal problems
Yeah.
have made everything so much worse. So that has definitely contributed to the nausea. But the first trimester was me saying, I don't think I can do this, a lot of that, and going, I don't know if I can go through. Maybe this was a bad idea. Maybe I need to end this. And for the first 3 weeks, I wasn't entirely sure if I was ready to go through it. And as the nausea got worse and worse and worse, I'm getting even more and more scared. And I spent most of the time just crying on my couch and saying, I don't think I can do this. I don't think I can do this. And then I think when I went for the first ultrasound just to confirm the pregnancy, because I told them at that time I wasn't sure I was going to continue. Then seeing the first ultrasound kind of went, okay, like the heart's already beating. I am completely pro-choice, but at the same time, it's like, this is something I want. Maybe I need to go home and think about it.
Mm-hmm.
And so I took 2 weeks to think about it. And I came back and I said, and they were actually going to book me to end the pregnancy. And I came back and I'm like, you know what? I think I can do this. I want this baby badly enough. Yes, this is terrifying. Yes, my mental health is really bad right now, but I want to see if I can see this through.
Yeah.
And
So Jackie, can I just ask you, said that you'd already booked to terminate your pregnancy. So when you did that, how was I guess the reaction from other people around you, you know, both kind of the health providers, but maybe also your family or your husband?
They were all trying to convince me out of it, which I understand. They were trying to say, you just need to give it a bit longer and see, you want this, keep going. I had a few people who said, you know, it's entirely your choice. We understand your concerns. My husband was very supportive, but also obviously understandably upset because this is his child. But he said, you know, if you feel you can't do this, I will support you 100%. So I was lucky that I had that. My parents have been concerned for me about pregnancy since I was old enough to get pregnant. So they were terrified when they found out I was pregnant. And, you know, they wanted to make sure, of course, that my health came first. So they would have been fine with no matter what choice I made. They said, yes, of course, you know, we would love grandchildren, but not at the expense of you. Like, we need you. We would rather have you than grandchildren. So it was an interesting time. And I think a lot of women are actually embarrassed to talk about this. Understandably so. It's a very, very delicate topic. But if you look online and you go on these websites and chat rooms and Reddit, you'll find lots of women who are this terrified and are saying that they want to end it. So I started reading from other people. I'm like, okay, if I make this decision, I'm not alone. There's other people out there who are just as scared. And then I started talking to women who had the same fear as me, who had health problems and still got through pregnancy. And they were the ones who, that was really when I found a community of people suffering from emetophobia. And I found a bunch of women who had hyperemesis gravidarum?
Hyperemesis, yeah.
Yeah, so I found some women who had that, and they were also emetophobic, and they told me they got through it.
And that's why it's really helpful, isn't it? I think finding like-minded people or people experiencing the same circumstances as yourself to provide that support is crucial, isn't it? I think
that's what pushed me into, like, you know what, I can do this, because I saw that these other women had done it. And I saw that I have a friend who has a heart condition and a couple of other conditions, and she went through pregnancy twice. And so she was very encouraging. And then I just had people just saying, you know, we will support you, whatever you decide, but we know you really want the baby. And so after 2 weeks, I made the decision I'm going to go through with it. And I'm glad I made the decision then, because at that point, my nausea went up like a whole other level after that.
Yeah.
And it was like, I'm glad I already made this decision, because boy, would I be rethinking it otherwise.
You're kind of committed to it now.
I said, I'm committed. I have to go through with this. And if I throw up, I throw up. Luckily, I have not thrown up, which I don't know how. But again, I think your body just learns how to get through it, even if you feel awful. And I've actually been able, even though I'm still quite nauseous, I'm able to reduce some of my medication now, some of my nausea medication. So I'm down to a minimal dose at this point. And I'm also hungry all the time, which is a really good sign. So, because I am also a huge foodie. So it's like the first trimester, the combination of the nausea and the not being able to eat. And I love food so much. So that was really, really hard. But now I'm back to just being a nauseous foodie at this point. So
yeah. So have you had any other particular challenges during this time, would you say?
Yes. Yeah. So obviously a big one that would be impacting anyone right now is COVID.
Yeah.
So when
Definitely.
you are high risk, pregnant, and you have a pandemic going around, medical care is quite different. And so normally, someone like me with the heart condition, I would be seen quite often. I'd be having a lot of tests. I'd be seeing my cardiologist in person at least once every 3 months to make sure everything's okay. I have not seen my cardiologist in person at all. She's only doing over the phone right now, and she only brings people in if there's an absolute, like, dire concern at this point. So it took me a long time to get some of my tests booked. My basic annual echocardiogram that I've had every year since I was a baby, it took weeks to get that booked because it had been canceled, and then COVID cases started to spike, and then I had to have it rebooked. So that was a huge challenge. The fact is that things are changing week by week. Right now, as we speak in Toronto, it's October, the middle of October, and cases are spiking like crazy here. It's very dangerous. So I don't know what kind of, they might have more cutbacks as far as my appointments going forward. I think right now I feel very alone because when I have pregnancy questions, I don't know necessarily if it's a pregnancy thing or a cardiac thing. And
Mm.
that's probably the biggest challenge is this pregnancy related or is this cardiac related? And if my cardiologist is swamped with a million calls, I can't necessarily expect to get an answer right away because everybody's probably going through the same thing. So that is the biggest challenge with this pregnancy. And the other thing I would say, which is the biggest challenge, the second biggest challenge, is the lack of information for people living with disabilities, both visible and invisible, who are pregnant. And the fact that there isn't that much information out there. So when I came across you and everything, I was like, oh my goodness, there's something out there for people like me. That was going into this, I felt so alone because of that. I didn't, that was
Mm-hmm.
another reason why I felt awful at the beginning. I just didn't feel like anybody could relate to, like I couldn't relate to anyone. And I can't relate to like regular pregnant people. It's completely different. And even my own situation is very specific to other people with disabilities or invisible disabilities.
That's
So
right.
it,
It is very different, isn't it? I think. Yeah.
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 And so,
But I
combine
think,
that with COVID, it's very difficult.
yeah. Yeah. So that certainly is a challenge. I think, I mean, you have a lot of challenges with your disability and your pregnancy, and then adding COVID on top of that certainly creates a lot of difficulties for you. And I guess it's been really good that you actually have found some supportive people. So perhaps, um, not just the support group that you talked about, who also have a fear of vomiting, but also, a support group perhaps of other women who have cardiac conditions who are experiencing pregnancy. But I guess the thing is, it's quite difficult to find those, isn't it?
I like it. The one thing that I'm trying to, by getting the word out, by talking about this pregnancy, by going public with it, is trying to get more information online and in the mainstream about being pregnant and having a disability because maybe it was something that wasn't seen 20 years ago. You didn't see as many people who were pregnant getting, who were pregnant, who had disabilities, who were told when they were born that they didn't have much of a shot of doing anything when they were older. And now it's becoming more and more common, but there's still, the information has yet to catch up.
Definitely. And that's why we have our website, Disability Maternity Care, for exactly that reason, so that it does become mainstream, so that it's not even a thought, a different thought. It's just that, you have a disability, you're pregnant. Okay, great. Well, here are all the resources for you. You can be provided that support. What do we need to put in place during your pregnancy in order to support you as a new parent? So that's, yeah, it's really, really important, isn't it? Yeah.
Absolutely.
Yeah. So certainly a lot of challenges so far. One thing I'd like to ask you, Jackie, about is during pregnancy, there's often a lot of screening tests that women undertake, and a lot of those are around genetic and chromosomal testing. And I just wondered how that was for you when you were offered it, and kind of the information that you were given, and how it was in that respect.
So we decided not to do the extra screening tests because they weren't covered by our public health care system. And we had decided, my husband and I said that because, I was born with a disability, I've had an amazing life, that no matter what happened with our kid, that we were going to go through with this because you never know what an incredible life, even if our kid has a serious disability, she could have an incredible life. And yes, it is a girl, so we know it's a she.
Congratulations.
But thank you. But we said right from the beginning, we were like, we're going to continue. If the baby has Down syndrome, we're going through with this. If the baby has this, we're going through with it. It would basically take, it would take something huge, like the baby's not going to survive past a couple days for us to end for that reason.
Mm.
So we decided not to do all the extra genetic testing. We just stuck to the basics, which was the Down syndrome screening, which came back normal. And then the main
Sorry.
things, sorry?
Oh, no, you finish and then I'll ask what I was going to ask.
Oh, okay. So The other screening basically for me specifically was all cardiac, because my cardiac condition, I have a 1 in 20 chance of passing down, not my specific cardiac condition, but any congenital heart defect to a child of mine. So we had a screening at 12 weeks and nothing showed up. And believe me, when they showed me on the ultrasound that she had a pulmonary valve, I was thrilled because I didn't have one. And I'm like, baby 1, Jackie 0. So I was really excited. And then last week we had a second echocardiogram on the baby and showed no problem whatsoever. And as a matter of fact, they're not even going to do any more screening because they said if she's born with anything, it will be minor and fixable.
That's good news for you, isn't it?
Yeah. So we've basically just stuck to the regular screening stuff that we would do for anybody, because we both decided that whatever happens, we'll just deal with it. And we don't really want to know ahead of time. We're just going to deal with it when the baby's born, and we'll figure it out then.
Yeah. So Jackie, can I just take you back to you said that you actually did have the screening for Down syndrome, but you also said that if your baby had Down syndrome that you wouldn't choose to terminate your pregnancy.
That's correct.
So can I just ask what made you decide to undertake the Down syndrome screening?
It's not a very interesting answer.
Sorry?
It's not a very interesting answer. It's because it's covered by our provincial health plan.
Oh, right, okay.
It was just part of the normal screening. So I could have said no, but I was just like, okay, we might as well screen for it because it was covered. I didn't have to pay out of pocket for it.
Yeah.
So the other screening, any of the other in-depth screening was 800 Canadian dollars.
Okay, yeah, which is quite a considerable amount.
Yeah, so that's why we did the Down syndrome screening, just because it was free. So we said, well, we'll just do that one because it's covered by provincial health plan, so it's fine.
Yeah. Okay, thanks, Jackie. So thinking about now, you're halfway through your 20 weeks, so that's great, isn't it, that you're halfway through?
Yeah.
And I know that you've certainly got it quite a way to go, and certainly with the baby increasing, your little girl increasing her growth in this next kind of 20 weeks. How are you kind of preparing and planning for life after your baby?
I haven't even started thinking about it until I got we started thinking about it last week after we got the ultrasound results that we're having a girl and that she does not have a heart condition. I didn't want to prepare myself for after the baby until then. Yeah. But now we're starting to talk about it. We're starting to think about what baby furniture we want. And I'm even starting to think about silly little things like what songs am I going to sing to her? And, we've even started to pick out names now. But as far as planning disability-wise, would you like me to talk more about the rest of the pregnancy or after I give birth?
Just about really thinking about what things that you might need to put in place, for the rest of the pregnancy, in preparation, given your disabilities and how they might impact on your pregnancy. Yep, and then maybe a little bit about how you think you will go in those early kind of first couple of months, and in relation to your specific disability and how that might impact on your mothering.
Okay, so for the next 4 months and a bit before the baby's born, it's mostly going to be, obviously me calling my cardiologist a lot and saying and reporting on any symptoms and anything like that, but also it'll be basically it's my heart that's going to determine my birthing plan. So if my heart is showing signs that it could be heading towards a little bit of cardiac damage, even if it's like reversible upon when the baby's born, but if there's any signs of trouble, they will schedule me for a C-section.
Yeah.
The other thing is that I have to think about is because of this vulvodynia that I have in the pelvic floor, I could have a very, very painful experience anyway giving birth. It's almost like a skin condition in many ways, and it feels like literally your skin is tearing apart in your whole pelvic floor. So I might decide to go forward with a C-section no matter what. I'm thinking about it. I haven't really come to that conclusion. It's going to be difficult. It's already getting difficult for me to climb stairs. I'm very, very tired. So I realize that it will start to get difficult. I live in a townhouse. There's a lot of stairs. It's hard to get upstairs now. So my husband will have to help me out with a lot of things like bending over. He might have to pick up. He's really great with housework, but he might have to pick up even more housework because of me. Because I'm starting already to struggle. So, and again, like it'll be constant being in touch with my medical team and reporting back. And then really, probably in early January is when we're going to decide, okay, how are we having this baby? Is she going to be like through C-section, or am I going to try to give birth naturally? And no matter what, it wouldn't be like a natural, no medication, because they don't want my heart to be in any stress. So they would say no matter what, that I would need to get an epidural. I mean, obviously, if I said absolutely not, they're not going to, say, well, you have to have one, but they've recommended it and said that you need to have your pain controlled. And I'm good with that. So I'm like, take away the pain, I'm great. Yeah. As far as after the baby's born, it really depends how I feel, I think. If cardiac wise, I'm okay, it'll be a bit easier, but as our child gets larger and as she starts gaining weight, it's going to be hard for me to lift her. I actually did start weight training about 2 years ago so that I could be ready for this, so that I could be ready to carry a child. So I did Pilates for almost a year and a half, and that has helped tremendously increase my strength. But I'm not lifting. If she gains 20 pounds in the first year, it's going to be very hard to lift her. So I will need my husband to help with that, especially going upstairs. The other thing that I have to be very careful of is, again, I am not so much immunocompromised, but just I have a tendency, anything I get can turn into pneumonia. So if she gets sick, I have to be really careful around her. So that kind of scares me about, and I know this will be probably later on more when she's going to school, when she's older, but when flu season goes around or anything like that, like let alone COVID, that's a tricky time of the year for me. So I have to be very, very careful as far as not exposing her to germs, because if she's sick, I'm going to get sick, and then I can't take care of her because I'll be too sick. So it's really about, being very mindful of germs and all that. And obviously, even if it weren't for COVID, we would be very, very careful in who we bring into the home the first few months after she's born, because we can't expose either one of us to anything. So in many ways, COVID makes that easier because we have an excuse already. You can't come to our house. So that helps. But that's basically where my thoughts are right now. And, there are cases where people have needed open heart surgery after giving birth. I don't anticipate that's going to be a problem for me, but that's something you have to consider as well, is that if something happens to me, then my husband will have to be the primary caregiver or do 100% of the work. And I think he is completely prepared for that, and I'm not concerned.
Yeah. So do you need to make any modifications in your house in terms of supporting your heart condition, or are you thinking about perhaps you might need some extra help? I know you said just then that your husband is really good at helping around the house, but do you think, I don't know whether he gets time off work or not from his work position, whether it's going to need to be extended, or, whether you're thinking about those sorts of things as well, whether you've got family that might come in and help support you if he has to go back to work.
Well, the good news is, because of COVID, and this is like the positive things that come out of COVID, we have both been working at home since March. So he will be home, even if he's working, he will be home with us, which is fantastic. Now, I mean, there are days where I'm going to have to do a lot of the stuff, but I can always say, hey, can you carry her upstairs or something for me? So that is going to be a huge help, because we don't see him going back to the office at all. He's probably going to work from home permanently now.
Fantastic. Well, that's great for you, isn't it, then? So you'll sort of have him around as you need to.
Yeah. So
if you need that additional help.
Yeah. I mean, obviously the first few weeks he's going to take vacation. But I think that for all the things where I wouldn't, need him, like where I would need him around, he will be around now, which is a huge help. He's a big, strong guy. He can help me with a lot of stuff. So I'm really glad he's going to be around. It's been really great, actually, working from home the last 7 months and having him around every day anyway, because he's been very helpful. And especially since I've been pregnant, he's been here every day. We haven't spent a day apart. So it's been really great.
Fantastic. Yeah, no, that's really good. So just thinking about what advice might you give to other women with a disability around becoming pregnant or the support that they might need during pregnancy? I know we touched a little bit on it already, talking about the fact that there isn't a lot of resources and support, but what advice would you give to somebody who sort of said, I'm thinking about becoming pregnant? What do you think? What do you think?
Well, I think for each person, it's a personal decision. And so, you know, if you don't feel comfortable with getting pregnant, but you want to start a family, there are other options, obviously. But adoption is not as easy as people make it out to be. Adoption can be more difficult than surrogacy. Surrogacy is expensive. It's a very expensive, long process. It can take years, and you can be out hundreds of thousands of dollars, depending on where you live. If you have the money, it's certainly a great option. But there's, you know, adoption can be very difficult to, you know, there's not a lot of children up for adoption. And then adoption agencies can sometimes be afraid to work with someone with a disability, which is something that's not talked about, but I have seen evidence of it. So that's something else to keep in mind. Anybody who's looking to get pregnant, advice I would give them is to check out your options, make sure this is something you're comfortable with, but also if you do find yourself pregnant and you're freaking out and you don't think you can do this, to give it a couple of weeks and try to check out whatever resources you can, try to connect with people, make sure that this is like what you want to do. Don't make any rash decisions. Because I know sometimes it is hard that people get pregnant and they are in my situation and they freak out and they're like, I can't do this. So I would say, you know, talk to people, talk to understanding people. Don't talk to people who's not going to understand you. And try to find, there are still resources online, but something like, you know, your organization is amazing. But try to talk to like groups, try to find, there are groups online. It's just really hard to find. Reddit has been an amazing community, which is funny because you hear so many horror stories about Reddit, but there are some amazing communities on Reddit of people. So I would recommend talking to other people, but also realizing too that your journey will be completely different than anybody else. So your journey is not necessarily going to follow anybody that you talk to. You have to realize that your journey is your own. And I would recommend too is that just because someone tells you you shouldn't get pregnant, or someone says they're afraid for you to get pregnant, should not be taken into your final decision, because you have to put yourself first and you can't worry about what others think.
That's right. It's your decision and your life, isn't it?
Yeah, exactly.
Yeah. Fantastic. That's really important, I think, isn't it? And as you say, that every pregnancy and every person is different. So just because a person has one particular experience doesn't mean that another person with the same disability is necessarily going to have the same experience. It's good talking to people. You just take what you need from what they say and you can leave the rest, because quite often in pregnancy, don't you hear lots of stories, and particularly horror stories, I think.
Yeah. And that's the one thing I would warn people. You have to be very careful of horror stories, because I've actually posted on boards where I was posting on a Facebook group for women with vulvodynia. And I'm like, can you please tell me, you know, what you would recommend, what worked for you, but I do not want to hear horror stories. And then, of course, a couple women right away were, well, I have a horror story. And I'm going, yeah, no, I don't want to hear horror stories. I want to hear what you think is best, what I should be looking out for, what I should be asking my doctor, how to advocate for myself.
That's right. Because I think when you have a disability, I think it's just for any woman during pregnancy. I mean, you come to pregnancy, particularly the first time, you don't know what to expect. And everybody likes to tell you those, you know, sort of horror stories, which can only really increase your own, I guess, anxiety about what to expect. So it's really important to find that sort of positive support in pregnancy, isn't it?
Yeah, because I had a lot of negative voices at first too, and I had to end up tuning those out and saying, okay, what do I want? And that's basically what people should be asking, is what do they want? And they also should not, I would recommend, you know, it's very hard not to feel guilt or shame over your choice in some manner. If you know, for me with the surrogacy thing originally, I felt a lot of guilt and shame that I was asking someone else to help me with my choice. And I had to get over that, because it was like, well, you know, you're not asking them because you don't want your body to change, or you don't want to be pregnant. It's because you legitimately have concerns. So I think that's a tough thing to work through, is the guilt. And you're going to have guilt and shame if you're pregnant. You're going to go, you know, am I just providing the best environment for my baby in utero? Like, is my body okay for my baby? And so, or like the fact that I'm still on a lot of my medications that I was on before, are these medications safe for my baby? And so you'll have guilt and shame no matter which way you choose, and just expect that you're going to feel that. And you just, you know, if you need to work through it, I recommend definitely talking to a therapist. My therapist has been amazing. So.
Great. So before we finish, Jackie, is there any last comments you'd like to make and let women know?
I think too that there's also this misconception, and it's starting to get a little bit better now, but there's also a misconception that people with disabilities should not have kids, or should not have their own biological kids. And, you know, it's difficult when there is a chance that you can pass on your disability to your child, especially if it's genetic. I think, though, for everybody, it's really their own choice. And I would never tell someone who has a disability, you should not get pregnant because you could pass this on to your child. I use the example of, well, look, I had a 10% chance of surviving my first night. And look at how I turned out. I've already had a successful career in journalism. I've reached all my dreams and goals. I bought a house. I'm married. I'm having a child now. I got the chance in my childhood to meet some of my favorite actors and actresses, and my sports heroes. I had the most amazing childhood ever, despite constant hospitalizations, constant tests, constant everything. So I think that, you know, if your child inherits your disability, well, first of all, we have modern medicine now. We have modern medicine that can do absolute wonders, and that
That's
can,
right.
children who have what I have now, who are born with it, are treated immediately after birth, and some of them never know they were sick. And so I don't see a disability, if you pass it on, I don't see this as necessarily, this is a horrible ethical, like a problem, because you can make your child's life great no matter what. That's up to you, and you have the power to do that. And also, if they're going through, for example, something that you're sharing, you have something in common with them, you know how to get through it, you know how to help them through it. But the main thing is that people with disabilities have incredible lives, and we are not to be pitied. We are not to be said, oh, you poor thing. Like, I once had someone come up to me and say, I don't know how you get up in the morning, I would kill myself. And
Terrible thing to say.
it's
I can't believe somebody would say that.
yeah, I had somebody say that to me in high school, and I just looked and I'm like, is my life really all that bad? Like, I think my life is actually pretty awesome, considering it. And at that point I would be like, considering all the celebrities I've met, you know,
Yeah,
like
that's right.
it's a pretty awesome life.
How many have you met?
Yeah, like I actually got to meet Katy Perry when I was doing an internship once, and it was,
Wow,
she was a
fantastic.
huge pop star at the time, and it was just
Yeah.
like, you know, these experiences that and I've had to work twice as hard for a lot of them, but there's such a payoff. And so I'm really starting to embrace the word disability as well, and I think that it's nothing to ever be ashamed of. And so if you are a person with a disability and you want to have children, and there's a chance that you'll pass it on to your child, I you know, I don't think it wasn't really a factor in my decision, and it doesn't need to be a factor. It doesn't mean your kid's going to have a bad life. It means that you will be so much better a parent, because you'll understand if your kid inherits it. You will know exactly what to do.
Yeah. But I think, quite often someone with a disability faces those sort of negative stereotypes about not being able to be a parent, that, you know, if they can't look after themselves, how could they possibly look after a child, etc. Which I think is, you know, it's really a stereotype, you know, and it's the wrong perception to have, isn't it? I think, as you have said, that people with disabilities, you know, no matter what their disability is, can have an amazing life, you know, and their own dreams can be realised.
And
And it's up to us
I
as a society to actually enable them to do that.
something I do want to mention is that when I was looking at stuff early on in my pregnancy, just looking for information online, I did find a blog that was actually quite upsetting about a person with a developmental disability. It was the person's mother writing it, and about how they wanted them to make sure that they were sterilized. And I just read it with horror. And the terms that they used, I don't think they used anything like the R word, but it was still like, you know, words that would not, and this was in the past decade, and it was words that would not be used in 2020. And, you know, to say that my child should be sterilized because I don't want them having children, well, you know, that's their decision. And that's also something that their care team, that their doctors and their care team can help them decide. That's not up to you, mom. Like,
Yeah.
you know, it's not up to this mother who's trying to dictate that her daughter should not have children. Well, maybe she wants kids, and maybe she can look after them just fine. And maybe you need to let her and her care team come to that decision. So it really upset me. It really upset me when I saw that.
Mm-hmm. And it is even though, well, particularly in Australia, it's now illegal to have women with intellectual disabilities undergo sterilisation. There are still instances where families take their daughters overseas to have that done, unfortunately. But yes, you're right. It is. It's very much up to the young woman herself. And, you know, I think it can be very difficult, can't it? You know, as a new mother, for all of us, we need support as new mothers, whether we have a disability or not. Why do we expect that a person with a disability, and particularly an intellectual disability, why should they not access that support? Why do we expect them to be able to do it on their own?
Exactly. And that's why, I mean, people who do have an intellectual disability, they should be able to get support. If they want to have kids, it's perfectly up to them. They just they might need a little extra support, and that's fine. Again, it's 2020, and anything should go. It's not anything goes yet, but anything should be able to go in 2020, especially as we live through a global pandemic and we're seeing some positive social change as a result of it. You know, I actually consider myself very lucky to have lived through this year, even though it has been difficult. It has been a life-changing year on so many levels, whether, you know, not just personally, but everywhere in the world. So, yeah.
Yeah. Well, we've certainly touched on a lot of topics over our time this morning, Jackie, although it's your evening over there. Yeah.
It is almost dinner time here, yes.
Yeah. And thank you.
And thank you for the work that you do, because I was so glad to have found you on Instagram. And it was like, whoa, there's actually something out there. This is so cool. So it was great to find you. And then when you connected with me, it's been pretty awesome. And we will stay in touch. And also, if anybody who's watching this wants to also take in our podcast, you can find our episodes at what'sthedifferencepodcast.ca. And yeah, we talk about living with invisible disabilities and the stigma surrounding it, and how we advocate for ourselves and deal with people who don't want to listen to us.
Yeah, no, it's certainly a great podcast, and I can vouch for that. Yeah. Well, we'll wrap it up now. And I just want to say a big thank you for coming and talking to us today.